Friends, let's talk about something serious, something that affects each and every one of us, regardless of where we live or what we do. It's a conversation about our health, the health of our loved ones, and the well-being of our communities. Diet-related diseases are costing us billions every year. These are staggering figures, representing not just financial burdens, but also the immense strain on our healthcare system. This isn't just about numbers. It's about the underlying causes and the human stories behind those statistics. It's about real lives, our families, and our communities. It's about the people we care about, the moments we share, and the future we want to build together. Diseases like heart problems, which can often be debilitating and life-threatening, and diabetes, a chronic condition affecting millions, impacting their quality of life and longevity, are often linked to what we eat. The choices we make about our diet have a profound impact on our health outcomes. The good news? There is hope, and there is a path forward. We can change this. We have the power to make a difference, to create a healthier future for ourselves and for generations to come. Underserved communities often facing systemic barriers to accessing quality healthcare and nutritious food. Minority groups, rural areas, low-income families are disproportionately affected by these diet-related diseases. Face the biggest challenges and highest rates of these diseases. The disparities in health outcomes are a stark reminder of the inequalities that persist in our society. They have less access to healthy foods, often living in food deserts where fresh produce is scarce and processed foods are abundant. And that's not fair. Everyone deserves the opportunity to live a healthy life, regardless of their zip code or socioeconomic status. Their health affects all of us. We are all interconnected, and the well-being of one community impacts the well-being of the entire nation. It's a shared responsibility. We must work together to address these health disparities and create a more equitable society. The human cost is too high, the suffering is too great, lost potential, missed moments, and daily struggles. The impact of these diseases extends far beyond the individual, affecting families, communities, and society as a whole. But here's the hopeful part. We have the knowledge, the resources, and the determination to turn the tide. This is a crisis we can absolutely solve. By working together, we can create a healthier, more equitable future for all. On May 9, 2025, a pivotal moment in our nation's history. The FDA launched a bold new plan, a comprehensive strategy to address the root causes of diet-related diseases. A vision to make America healthy again. A commitment to ensuring that all Americans have the opportunity to live long, healthy, and fulfilling lives. This plan is a game changer, a paradigm shift in how we approach public health. A fresh start, a chance to build a healthier nation from the ground up. It's our chance to build a healthier future for everyone, a future where everyone has access to nutritious food and quality healthcare. We are not helpless. We have the power to create change, to build a better future for ourselves and for generations to come. So let's dive in and see how. Let's explore the details of this plan and discover how we can all contribute to making America healthy again. America faces a major health challenge, a crisis that's impacting families and communities across the nation. It's a situation that demands our attention, our concern, and most importantly, our action. We're not just talking about abstract numbers, we're talking about the well-being of our loved ones, our neighbors, and ourselves. Rising rates of heart disease, which remains a leading cause of death and disability. It's a silent epidemic, often stemming from years of unhealthy habits and lifestyle choices. Type 2 diabetes, a condition that's becoming increasingly prevalent, particularly among younger generations. The long-term consequences can be devastating, affecting everything from vision to kidney function, and obesity. These conditions often go hand in hand, creating a cascade of health problems that can significantly reduce quality of life and lifespan. These aren't just statistics. They're our neighbors, our families, the people we see every day. They're the faces behind the numbers, each with their own story and their own struggles. The main reason? Our diet, the food we consume on a daily basis. Too much processed food laden with artificial ingredients and lacking in essential nutrients, packed with sugar, often hidden in unexpected places, contributing to weight gain and insulin resistance, unhealthy fats which can clog arteries and increase the risk of heart disease, and salt. Excessive sodium intake can lead to high blood pressure and other cardiovascular problems. These foods are cheap and easy to find, making them a convenient option for busy individuals and families on a budget, but they don't nourish us. They provide empty calories and contribute to a cycle of poor health. Many communities suffer more, facing systemic barriers to healthy living. minority groups who often experience disparities in access to healthcare and healthy food options, rural residents who may live far from grocery stores and lack transportation to access fresh produce, and low-income families face extra hurdles, struggling to afford healthy food on a limited budget. Food deserts, areas where access to affordable, nutritious food is severely limited. Places with fast food everywhere but no fresh produce, creating an environment that promotes unhealthy eating habits, are real. They are a stark reminder of the inequalities that exist within our food system. This isn't about willpower, it's about access and opportunity. It's about creating a level playing field where everyone has the chance to make healthy choices. But these diseases are largely preventable. With the right knowledge and resources, we can significantly reduce our risk. You are not doomed to get sick. Your health is not predetermined. You have the power to make positive changes. We can fight back. Together we can create healthier communities and a healthier nation. It's about the food environment, the choices that are presented to us every day, and the choices available to us. We need to ensure that healthy options are accessible and affordable for everyone. The new FDA plan tackles these issues head-on, aiming to create a food system that supports health and well-being. It aims to change the environment and empower you to make informed decisions about your health. This is about justice and hope, ensuring that everyone has the opportunity to live a healthy life regardless of their background or zip code. With the right information and support, we can empower individuals and communities to take control of their health. We can turn things around. We can create a future where everyone has the chance to thrive. The time for change is now. We cannot afford to wait any longer. Let's see what's next, and how we can all be part of the solution. Here's some fantastic news. The FDA and NIH have joined forces. On May 9, 2025, they launched the Nutrition Regulatory Science Program. Their mission: make healthy eating easier for everyone. This partnership is about teamwork for your health. The goal? Clear, simple tools to help you make better choices every day. It's also about making healthy food more affordable. No more choosing between your health and your budget. This program puts fairness and equity front and center. For too long, some communities have been left behind. Now everyone gets a fair shot at nutritious food. This is true progress. A level playing field for all Americans. Let's see how this will work for you. Let's talk about food labels. No more tiny numbers and confusing words. The FDA is introducing a new front-of-package labeling system. Simple, clear, and easy to understand at a glance. Imagine a traffic light system or star ratings: green for go, red for think twice, or icons like good source of fiber or low in sugar. The goal is clarity, information you can use in seconds. This empowers you to choose wisely and quickly. It's a game changer for busy families and anyone juggling work and home. No more guesswork or deciphering complex charts. Just honest information, right where you need it. Healthy choices become easier for everyone, especially for parents and those with limited time. This is how we make shopping simpler and healthier. Let's make every trip to the store count. Let's look at what's in our food: too much sodium, sugar, and unhealthy fats. These ingredients are often hidden in processed foods, even those that sound healthy. The FDA will work with food companies to gradually reduce these unhealthy ingredients. It's about making the food supply itself healthier, not banning foods. Setting targets for less sodium, sugar, and bad fats. The benefits: lower blood pressure, fewer strokes, less diabetes, and better heart health. More energy and longer, healthier lives for everyone. Food companies can innovate. Delicious foods can still be healthy. Reformulation and smarter ingredients are the way forward. The goal: better nutrition without sacrificing taste. This is a win-win for all of us. Healthier options that still taste great. Together we can make a real difference. Let's build a healthier food supply. Knowing what to eat is crucial, but many people haven't had the chance to learn. Nutrition education is key, learning what makes a healthy plate and how to cook nutritious meals. The FDA is boosting education efforts, working with programs like WESI and SNAP-Ed. Tools like My Plate show how to build a healthy meal: fruits, veggies, grains, protein, dairy. But education isn't enough. We need better access to healthy foods. The FDA will support initiatives to fight food deserts and bring grocery stores to underserved areas, supporting farmers markets and making fresh produce more available. This is about empowerment, giving people knowledge and resources. When people are informed and have access, they make better choices. This combination creates real, lasting change. Healthier communities start with education and access. It's about building a better future for all. Let's empower every generation. In the past, health initiatives haven't reached everyone equally. There have been systemic barriers and unintentional oversights that have left certain segments of our population behind. We recognize that a one-size-fits-all approach simply doesn't work when it comes to health and well-being. Vulnerable communities were often overlooked. These are the people who need our support the most, including low-income families struggling to make ends meet, elderly individuals facing isolation, and rural communities with limited access to healthcare facilities. This new FDA plan is different. It's built on the understanding that everyone deserves the opportunity to live a healthy life, regardless of their background or circumstances. Equity is at its core. This means actively working to remove barriers and create opportunities for all communities to thrive. Fairness and justice mean no one is left behind. We are committed to ensuring that every individual has access to the resources and support they need to achieve optimal health. The plan uses tailored messaging. We understand that communication is key, and that messages must be relevant and accessible to diverse audiences and culturally appropriate resources. We respect and value the unique cultural traditions and practices that influence people's health choices, healthy eating tips that respect traditions. We want to empower people to make informed choices about their diets while honoring their cultural heritage and fit diverse lifestyles. We recognize that everyone's life is different, and our recommendations must be practical and adaptable to various schedules and circumstances. The FDA will work with community leaders. We believe that collaboration is essential to success, and we are committed to partnering with those who know their communities best, and local organizations to ensure effectiveness. By working together, we can reach more people and make a greater impact. Equity is woven through all strategies. From research and development to implementation and evaluation, we are committed to ensuring that equity is at the forefront of everything we do. Labels, food supply education, and access. These are the key pillars of our strategy to promote health equity. New food labels will be easy to understand for everyone. We are committed to providing clear and concise information that empowers consumers to make informed choices, regardless of language or education. We are working to overcome literacy barriers and ensure that everyone has access to the information they need to make healthy choices, improving the food supply. We are working to increase the availability of healthy and affordable food options in all communities. Helps those who rely on processed foods. We want to provide healthier alternatives and empower people to make informed choices about the foods they consume. Education and access efforts will target. We are focusing our resources on the communities that need them most: minority, rural, and low-income populations. These communities often face unique challenges that require tailored solutions. The goal: close health gaps. We are committed to reducing health disparities and creating a more equitable society, and give everyone a fair shot at a healthy life. We believe that everyone deserves the opportunity to reach their full potential, and that health is a fundamental building block for success. No matter your zip code, income, or background, we are committed to reaching everyone, regardless of their circumstances. This is a comprehensive approach. We are addressing the root causes of health disparities and working to create lasting change for a healthier America. Together we can build a nation where everyone has the opportunity to thrive, a promise of a brighter, healthier future for all. We are committed to creating a world where everyone has the opportunity to live a long and healthy life. Let's make equity a reality. Join us in this important mission to create a healthier and more equitable future for all Americans. What does this mean for you? Real, positive change is coming. The new FDA plan is a roadmap to a healthier nation. Easier choices at the store, healthier foods on shelves, more support for everyone. Here's your part. Embrace these new tools. Use the new front-of-package labels to guide your choices. Let this information empower you and your family. Demand better options from food companies and local stores. Your choices send a powerful message. Consumers drive change. You are part of a movement for better food and better health. It starts with small steps, one healthy choice at a time. The FDA plan gives us the tools, but we have to use them. Let's be hopeful, active, and take control of our health. Together, we can build a healthier future. Let's start today.